Program sustainability refers to the ability of a public health program to continue delivering its intended benefits over time. It'll involve ensuring the program's long-term viability and effectiveness in addressing the health needs of the population that it serves. We really feel in public health, if you don't sustain that important work of your program, valuable resources can be wasted and communities can actually be negatively impacted through the loss of trust in public health initiatives.
And public health planning is instrumental, in part because we are wanting and trained to work in the time frame short, mid, and long term. And by the very fact of looking at what you're intending to do and where you're going and in which time frame you want to see that happen, you're naturally, or have an opportunity at least, to build in sustainability, especially as we work toward a long-term part of our work and how are we going to sustain the effort in order to realize the long-term impact. So I see public health planning and sustainability really going hand in hand when you start early asking yourself and your stakeholders, how are we going to sustain the work and build upon the work ideally in order to realize that long-term impact?
Planning for sustainability is key to all public health initiatives. So whether you're planning something to address policy, system, or environmental change, when you are implementing a new initiative or a grant or a pilot, you're really hoping that you're going to have positive outcomes. And from the very beginning of the work, you want to be considering, how are you building sustainability? What are the things that you need to do to create that? And I think that's key in all public health, as well as in looking at the Healthy Brain Initiative. In public health, you're always taught that when you begin a project, you should be thinking about right away, how are you going to measure the outcomes? I consider thinking about sustainability the same.
We're really appreciative of the Healthy Brain Initiative and the work that it's allowing us to do, because as folks roll through each part of their life, if we don't have sustainability, the hours needed to kind of reinvent the answers to the same questions as your next age group of people roll into that same part of life takes away from our overall capacity to do the work. So we've got to create sustainability around this.
When we've been implementing the Healthy Brain Initiative or the HBI, we've tried to focus on sustainability through a few methods, and one is making sure that our public health colleagues have the latest data and research around brain health and how it's connected to the work we're doing, especially when we're looking at chronic disease prevention or the mitigation of chronic diseases.
Another way that we work to build sustainability into our Healthy Brain work is to identify a leadership champion. We need work happening from the top down, buy-in from the top down, and from the community level up, so that we can hopefully meet in the middle to get towards solutions that we're both working on from our individual perspectives, from our group perspectives, and then carry forward together within that middle ground. So having a leadership champion for us in our Healthy Brain Initiative work, it's our health protection director, so that our folks in the community can come through and meet with other experts and do the planning locally, has made a huge difference and really gets us to that sustainability where we're making this work part of our normal operations.
Another area of work that entails both, I think, building in sustainability as well as inclusivity is that our intent is low-cost infrastructure building. We started out, and sometimes it's helpful not to have much or any funds actually when you're starting out work, because you're really looking at partnership and really also looking at what infrastructure already exists that you can build upon.
Funding is not the only type of needed and critical resources for sustainability of our efforts. Institutionalizing practice in local communities is key to these efforts as a whole. We want to make sure that, again, in abundant times and in lean times, we are able to keep this work going.
So the sustainability framework that we developed identifies 8 organizational and contextual domains that help build capacity for maintaining a program. The first domain is environmental support, and that's having a supportive internal and external climate for your program. There's also funding stability, which is establishing a consistent financial base for your program. Next is partnerships, and we think about that as cultivating those connections between your program and its stakeholders. Organizational capacity, which is having the internal support and resources that are needed to effectively manage your program. Program evaluation is assessing your program to inform planning and document results. And then the counterpart to program evaluation is program adaptation, which is taking action to adapt your program to ensure its ongoing effectiveness. Then we have communication, so strategic communication with stakeholders and the public about your program. And then finally, strategic planning, using processes that guide your program's direction, goals, and strategies. We do encourage programs to think about domains that they can address other than funding, because all 8 of those domains are important to sustainability. Just as important or sometimes more important than the funding piece.